Hi guys, welcome to Radhika. This is Dr. Radhika and welcome to series on tumors on female genital tract. Hope you're enjoying this series. So the tumor for today is teratoma, and teratoma has something to do with this image. Any guess? This is a monster, and whenever you see the gross image of a teratoma, it appears like a monster, like a disorganized tissue which has got teeth, hair, and other structures. Okay, so teratoma resembles a monster. So for the previous 2 days, I've been talking about the origin of ovarian tumors, the surface epithelial tumors which originate from epithelium. Then you have the germ cells from which you have germ cell tumors. Then you have the stroma from which you can have, and the sex cord cells from which you can have sex cord stromal tumors. So teratoma is a germ cell tumor because it can have derivatives from all the three layers like your ectoderm, endoderm, and mesoderm, right? So teratoma is a germ cell tumor, right? So the classification under which it comes under is it's a germ cell tumor, and it's the most common germ cell tumor in females, right? It's the most common tumor in females. It can occur in males also, it can occur in the testes as well. In females, it occurs in the ovaries most commonly. And coming to the gross appearance of teratoma, so this is how it looks like a monster with a shaggy appearance. So most of the teratomas can have solid as well as cystic areas. And one of the striking features is they have pultaceous material. Are you able to see some gray white to creamy shaggy material? This is called pultaceous material. Okay, you can have these pultaceous material, you can have teeth, okay, you can have teeth, and all these are hair. So when you see such a tumor, a solid cystic tumor, and lot of hair, pultaceous material, teeth, so they have a varied appearance. So this is the gross appearance of a teratoma. And are you able to see this yellow area here? So this must be probably your adipocyte when you look under a microscope. And in the gross appearance, what you should know is sometimes it can be predominantly cystic, but you can have some elevated area. So a raised protuberant area. So that area we call it as Rokitansky protuberance. So why is Rokitansky protuberance important? Because that's the area when you take sections from that area and submit for histopathological examination, you are most likely to see derivative from all three layers like your ectoderm, endoderm, and mesoderm. So this is of utmost importance in your gross appearance, right? So this resembles a monster. Coming to the microscopic appearance, you can have any tissue which has been derived from ectoderm like your skin. You can have endodermal derivatives like your lining of your GIT. You can have mesodermal derivatives like your bone, your cartilage, and all those, right? You can have anything. So what you need to concentrate on is you can classify the teratomas into mature teratomas, immature teratomas, or sometimes we have a specialized group called monodermal teratomas. So this is of utmost importance, and you should always look for any immature tissue. It could be an immature neuroepithelium or an immature cartilage or anything, any immature element you have to carefully look for, because if you have immature tissue it indicates a malignant behavior. So this is of importance in females, whereas in males, if you get teratoma, what is most important is whether it is prepubertal or postpubertal. Okay, so in men, irrespective of whether you have a mature or a immature teratomas, your postpubertal teratomas are considered malignant. So this is in case of males. Okay, so remember, in males, postpubertal teratomas are considered malignant, right? Now going to The teratomas in females, you have to look for immature elements. If you have an immature element, it qualifies as an immature teratoma. So if you can have a mature cartilage, so this is how a cartilage appears, a bluish tinge with lot of chondrocytes which are benign. So this is a cartilage, and I showed you the yellow area. So all these empty spaces, all with a nuclei, all these are adipocytes. Here you have lobules of cells with a clear cytoplasm. These are sebaceous glands. Here you are seeing some ductular structures, right? And here you see a bone. Okay, so you're having some. You can have skin as well, which is not in this field. You can have a skin epidermis as well, right? So you have derivatives from different layers. So it's a mature teratoma. Sometimes you can see immature elements like this. This is an immature or a primitive tissue, a fetal tissue, a neuroepithelium, which is forming a rosette, So for those of you who don't know what is a rosette, I've posted a rosette video on rosette previously. You can watch that. Okay. So when you have an immature tissue, it qualifies as a immature teratoma. Okay. So this is very, very important, right? So this is about the gross and the microscopic appearance of teratoma. Then I was telling something about a highly specialized or a monodermal teratoma, in which what happens, you don't see cartilage, bone, neuroepithelium. What happens, you will have one tissue component extensively. So you have a particular type where, if I don't tell you the site, you will call it as a thyroid tissue. You will see lot of thyroid tissue. So in a tumor from the ovary. So this we call it as a struma ovary. Okay. So it's a particular type of specialized monodermal teratoma. It's called struma ovary. One more type is called carcinoid. So these two are a monodermal teratomas, right? So we have seen about mature, immature and monodermal teratomas, and always try to look for immature elements in a ovarian teratoma. So what age group do you think these teratomas are common? Teratomas are common in young age group, especially the reproductive age group. So it's a tumor which occurs in an young age, especially the reproductive age group. They usually present as cystic masses. They can have solid areas. Okay, and you have to sample extensively to look for different areas. This is about the different types of teratomas. Okay, and one more interesting feature is sometimes teratomas can be associated with other ovarian tumor like mucinous cystadenomas. So you can have a association of your teratomas with mucinous cystadenomas as well. So this is about teratoma. So let me summarize about teratomas. So teratoma, as I've discussed, it's a germ cell tumor. It's a germ cell tumor, and most common age group, it occurs in young age, especially your reproductive age group, and grossly it appears like a monster. You have a solid area, you can have cystic area, you can have hair, you can have pultaceous material, then you can have teeth. And you have to remember about Rokitansky protuberance, which is a elevated raised area from which you can possibly get all the three derivatives. So microscopically, you classify teratomas as immature, mature teratomas, and monodermal or highly specialized teratomas. So mature will have all the differentiated mature tissue. You can have cartilage, bone, adipose tissue, skin, your GI lining, your respiratory lining, or anything. Immature, you have undifferentiated or embryonic tissue. It could be a immature neuroepithelium, your glial tissue, or immature cartilage. Monodermal, you have only tissue which is differentiated into one particular type, like your thyroid tissue, which is called struma ovary, and the carcinoid. So these are the important points about teratoma. So for those who want to go ahead further a step ahead and know some more important point about teratomas. So teratoma can be associated with a particular type of paraneoplastic syndrome called encephalitis. It can have limbic encephalitis. So it's a paraneoplastic syndrome associated with your teratomas. And I was mentioning teratomas can occur in males as well. It can occur in the testis. If it occurs in a postpubertal male, irrespective of whether it's mature or immature, it's considered malignant. So this is about teratomas. Thank you.